We've got Alexandra Terrell, Dr. Alexandra Terrell, from the University of Utah. And Alexandra is going to be speaking about finding meaning and joy through recreation. And I don't know about you guys, but at the Brain Injury Alliance, we've been getting so many calls, especially with COVID, just people asking, hey, do you have any support groups that get out and do outdoor activities and things like that? And unfortunately, there's not a lot of recreational type things, so I'm super excited to hear about Alexandra's presentation. Thank you.
Good afternoon. You tired of me yet? I am so excited to talk about this topic. As you know, or maybe by now you know, I am faculty in the Department of Occupational and Recreational Therapies. So whereas I am not an OT, nor am I an RT, I am right in the middle of where all of that good stuff happens. And I like to think of recreational, adaptive recreation and rec therapy as kind of my pet passion, right? I think this is one way where getting patients engaged, re-engaged in activities that they love to do or that they used to love to do can be so critical as part of their recovery process. And I don't know if you can tell from where you're sitting, but I talk with my hands a lot, and holding the microphone is like really, it's hard for me. So it's kind of, I've really enjoyed the presentations that have kind of been up to this point. And one of the things I was thinking actually earlier is we have this beautiful sequence of this idea of helping patients and their families sort of redefine and rediscover who they are, really recognizing that journey and supporting them through that journey. And it's kind of funny because I had a very similar sort of activity that I was going to have you do as part of the introduction for this topic, which was think about how you would describe yourself to someone who doesn't know you. What kinds of words would you use? How would you describe yourself? I'm sure some of you would describe yourselves in terms of your relationships to others, right? You might be a mom, a friend, a partner, a daughter, son, anything like that. So we covered relationships earlier. We know they're really important, right? But there are lots of other ways we describe ourselves. It could be through the work we do. But I bet many of you would also use some of the activities that you enjoy doing. Hiking, running, skiing, or maybe not so much skiing, biking, any of those things. And then you have something happen like a stroke, and it changes everything. And now suddenly you're not able to do those activities or not do them in the same way that you used to. Now how do you define yourself? How do you describe yourself to others? It is a loss and it is significant. And again, discovering new activities post-stroke that give joy, that give meaning, can be so critical in that journey of recovery. The same disclosure I showed earlier. So I'm going to specifically talk about adaptive recreation here. We're going to talk about the benefits of participating in adaptive rec post-stroke. We're going to describe ways stroke survivors can connect with activities and hobbies post-stroke. And then I'm also going to list available resources and knowing where to find more. And I think this latter part is particularly important. This is the same slide or a similar slide I showed earlier, so I'm not really going to rehash it. I just wanted to kind of put it back up there to remind you, hey, look, we know we have a lot of people who survived a stroke out there, and many of them have lasting physical, cognitive, and emotional sequelae as a result of the stroke. It's not just a short time, acute kind of thing. It can go on for years and years and be more of a chronic condition, and that's how I think, at least in my profession, is how we conceptualize it and how we think of it and how we would treat patients. And again, resilience is one of those ways that we can protect against some of those negative effects that stroke can have on mental health, for example. It can be a protective factor in terms of both preventing things like depressive or anxiety symptoms, as well as protecting against the negative effects that depressive or anxiety type symptoms can have on things like quality of life. Here we go. Here's the new material. One of those, why is that all underlined? That's weird. But one of those ways is through finding meaning, right? Meaning and purpose in our in our lives can be a source of resilience. Having a sense of purpose and meaning in life is associated with both physical and psychosocial benefits. And unfortunately, stroke survivors are at a risk of a lower sense of purpose and meaning because of that sense of loss. And participating in social and leisure activities is related to less depression and improved well-being, functional recovery, and survival post-stroke. So being able to kind of rediscover and re-engage in those meaningful activities, or maybe finding new activities that give you meaning and purpose, can be a source of resilience and can be protective in many ways. I'm going to try to play this video. It's again from our intervention that I talked about earlier.
Finding meaning. Finding meaning is searching for purpose in your life through something larger than the individual self. You can do this through self-reflection or finding the sacred in ordinary things. This means caring for your soul. Research suggests that people who find meaning are happier, healthier, recover better after trauma, and live longer. Finding meaning contributes to your sense of security and purpose in life. Here are some examples of activities for finding meaning. Try these activities by yourself. Reflect on your values. Consider what is most important to you. Take photographs of things that make your life feel meaningful and reflect on these things. Meditate, pray, or practice finding the sacred in ordinary life. Try these activities together. Share your thoughts on living a meaningful life. Find value by being creative together. Feel free to practice these or other activities to find meaning in your everyday life.
But as you probably noticed, a lot of the activities that were shown in that little video are recreational activities. An interesting display. It's doing something weird to my slide, but one way that I kind of want us to start thinking about resilience, and I'm sure most of you have heard of this model before, but it's the biopsychosocial model. Yes, biopsychosocial model, we're familiar with this. So the biopsychosocial model of resilience specifically just kind of wants you to consider that there are biological, psychological, and social components of resilience, and this is how we should be thinking about our clients, patients, their families, as well as potentially ourselves, right? One of the basic tenets of the biopsychosocial model, generally speaking, not specific to resilience, but generally speaking, is that well-being is not merely the absence of a disease. And this is kind of at the core of this, right? And why I think the focus on resilience can be a way for us to help strengthen, resources, build on existing strengths, and really not just focus on the deficits, but move forward, right? Move beyond. So when we're thinking about the biopsychosocial model of resilience, we have different things, including the physical component. So this is maintaining health and fitness. We have the psychological component, which this is maybe a little bit more of the traditional way we think of resilience, right? The coping skills, optimism, being hopeful, having a sense of mastery, sense of purpose and meaning making, and also positive emotions. Do not underestimate a good sense of humor or the power of a good sense of humor. And then the social component, which is engaging in valued activities, social connectedness, social support, and family support. And so if we're thinking about building resilience the biopsychosocial way, we really want to kind of take stock of all three of these areas, because the idea is that you might have some deficits in some of those areas, or your patients or clients might have some deficits in some of those areas, but they have strengths in others, right? And they come together, and where it intersects, that's sort of their reserve of resilience. And so, doing things like practicing good health behaviors, right? Physical activity and exercise, good nutrition, sleep. I think someone mentioned sleep earlier and how important that is to neuroplasticity. Those are all really important to strengthening or adding to that physical piece of resilience. Stress management, engaging in meaningful activities with others, getting at that social component. So we're going to now bridge into adaptive recreation. This is all going to tie together, you'll see. Hang on a second. What is adaptive recreation? Can someone tell me what it is?
Like hobbies or recreational leisure activities, like they're just modified or devices.
Yes, and I will repeat that because, oops, too far back. But adaptive recreation, sometimes also called inclusive recreation, basically allows individuals of all ability levels to participate by adjusting recreational activities to fit the level of functioning for individuals with disabilities. So they include, but are not limited to, sports, arts, crafts, theater, cooking, and social gatherings, and so on. Here are some examples. This is maybe perhaps what most think about when they think of adaptive recreation. We have, the adaptive basketball team there. We have some adaptive yoga happening, adaptive cycling, climbing, skiing, golf, and volleyball. And I find that sometimes when I talk with patients about adaptive recreation, this is kind of what they have in mind. And they're like, oh, but I'm not really a sports person, right? This is not really for me. And we know we need to make these kinds of things meaningful, right, to our patients. Well, what do they like? What did they used to like to engage in, or what would interest them in getting into? Maybe it's a new activity that can be adapted in some way. And I fully realize that archery and fishing are also sports, but I don't think it's typically what people think about when they think about adaptive recreation. And so here are some examples. We have painting happening here with an adaptive holder for the, not pencil, paintbrush. We have cooking that's going on with adaptive equipment for that. There's theater, there's knitting with like adaptive equipment that goes along with that. And then, of course, as I already mentioned, the archery and fishing. So there are lots and lots of options, lots of ways that we can adapt activities, recreational activities, for our patients to engage in. So adaptive recreation, I am going to throw this out there that we can use adaptive recreation as a vehicle to resilience through the use of this biopsychosocial model. So for example, getting at that physical piece, right? Maintaining health and fitness. Yes, if we can get someone back to cycling, or they want to try something new, like maybe they want to go bowling, or whatever it is, it's getting them out there, it's getting them active. It can build things like coping skills, mastery or sense of self-efficacy, a sense of purpose, meaning, and of course positive emotion, because this is supposed to be fun. Engaging in valued activities, social connectedness, and social support are then also up there in that circle. But you know me, I have to go back to the research, so I'm going to tell you a little bit about the potential benefits. It's interesting because when you go into the literature, there's actually not that much evidence base for, how effective adaptive recreation is in terms of improving depression or whatever else outcomes you have. That said, there is a wealth of evidence in terms of focus groups, interviews, so more like those qualitative studies or descriptive studies, which are also valuable. So we do know that the literature shows that engaging in social and leisure activities can protect and reconstruct the self, right? Rebuilding that sense of identity, redefining yourself in this new context, and enable participation in valued activities, which we know is really, really important, right? Everyone, OTs especially, yes. Regular participation in adaptive recreation activities has been shown to improve emotional and physical well-being, community integration, life satisfaction, and quality of life. So there's not a ton of evidence out there, but the stuff that's out there seems to tell us this is good stuff. So we, as I mentioned, engaging in adaptive recreation, or this topic of adaptive recreation, is kind of a side passion or a pet passion of mine. And so I was really interested in working with some of the students in our programs, both in the rec therapy program and the MOT program, because they were interested in recreational adaptive recreation. And so we kind of did this needs assessment survey as part of just trying to get a sense of, what do people know? What are they reporting? How do they feel? So we had this, we called it the SPARK project, because everybody has to have a good acronym. This is a support and participation through adaptive recreation project. And we had both a survey, and then we also did some follow-up interviews with people. As benefits, people said that, about half of them said they felt stronger, more than half said it improved their mood, and about 3/4 said they feel more open to other new experiences. Think about that as like an implication or an application to other things, right? If this kind of opens the door to them, to encourage them to go out and try new and different things, that's pretty great, that's pretty big. Some of the things we were hearing in our interviews was, being disabled is really isolating. It's really nice to feel like connected to other humans. And I'm more self-confident now. The stroke affects me in various ways, but I feel more self-confident now. So clearly we're seeing more benefits than just physical benefits. So my pet project turned into kind of a bigger thing when I kind of decided to partner up with a community organization for adaptive rec in Salt Lake City. It's the Wasatch Adaptive Sports group. And they actually had approached me because they were really interested in looking at the effects of like an adaptive cycling program. And potentially seeing, what could this do in terms of stroke survivors' physical function, and then we also talked about looking at psychological and social outcomes, because I was interested in that. And so we did this study. I called it Spokes for Strokes. It was a pilot trial that we did over 16 weeks, where we took baseline, 8-week and 16-week assessment, and we looked at all three of those areas: the physical, the psychological, and social outcomes. These were individualized cycling sessions. Participants were matched with a Wasatch Adaptive Sports instructor and an adaptive bicycle. We did this outdoors, so it was at a local park. And to follow up on that, we then also did a focus group, because we really like talking to participants and not just get numbers from them. So I didn't get too into the details here and show numbers, but one of the things that really stuck out was, we saw changes in all three areas, physical, psychological, and social outcomes. So we saw, lower resting heart rates, increased blood oxygen. We saw improvements both for the 2-minute walk test and a 10-meter walk test. And then we saw changes in positive affect, well-being, and satisfaction with social roles and activities. We had some other measures in there that we didn't have any significant findings on, but I decided to put these on there just so you can see, yes, we had people participate for, some of them we only caught for 8 weeks. And this was kind of a weekly participation. We didn't have any very strict sort of, requirements. They just needed to be engaged and show up for the weeks and the assessments. In our focus groups, we also saw some common themes, including that there was a sense of community or a feeling of community as they were engaging in these adaptive cycling groups. Physical and emotional self-efficacy, right? The sense that yes, they can do this, and yes, they can handle things a little bit better. And also this awareness of occupational capacity, or the things that they are capable of or could be capable of beyond just the cycling. So again, I just think it's really fascinating that you can take something like adaptive cycling, which we had them get on these adaptive cycles, and they just rolled around, in the park. And then we're seeing sort of this trickle-down effect of not only are we seeing physical improvements, which you might expect, right, if someone's participating for 8 weeks in a program like this, but also the psychological and social components that almost seem to carry a little bit more weight when it came to the participants' experience. And speaking of, these are some of the things we heard during the focus groups. So we had one woman, she said, everyone thought I was too delicate to be out in the snow, I guess. So this helped me be strong and get the strength and courage that it's still okay to ski, And I should add here, she was doing the cycling program, but she also participated in adaptive skiing. I think this helps you accept it more. This is you, this is who you are, and you're gonna go on, That is a good life now. And like doing makeup, mascara, and I know those are like tiny things, but then I tried buttoning and stuff like that. It gave me a lot of self-esteem to try other things. You shift how you think about yourself and work different ways. And when you participate in these things, because it gives me more courage to do other things. When the doctors can't say that this will be back to normal and this will be fixed, you see only you. I think adaptive recreation helps you see that there's other people out here. There's all these other people, and they come together. And then finally, from this woman, the pictures are not where the quotes are coming from, just as a disclaimer. I choose not to be a victim. I really want to be a survivor, and I can share that with people so that they won't feel as scared as I was. And that's really what it's about. So if adaptive recreation is so great, why doesn't everyone participate? There have been some studies on this, looking at both facilitators for participating as well as barriers to participating. And I'm sure most of you are aware of many of the barriers already. But some of the facilitators are things like social support, having interactions with others. We kind of talked about that a little bit, as well as some personal factors here, mostly tied to beliefs about kind of the having improved skills, the acceptance of the disability, increased self-esteem and self-efficacy, fun, enjoyment. This one was with a VA population, so they also noted connection to the military. Previously participating in some kind of a recreational activity was also something that often facilitated people to get back into those kinds of activities. But I will say, anecdotally, that sometimes that's a hindrance. Someone might feel like, oh, well, I'm not going to be able to do it the way I used to do it, so it's not going to be as enjoyable. And that is absolutely valid. And then maybe it's time to think about new activities, something different to try. Some of the barriers, distance from places that offer adaptive recreation opportunities, having insufficient materials, inadequate facilities, having a lack of information, cost, not having transportation, limited accessibility. Sometimes just being in a large group dynamic, if that's how it's set up, can be overwhelming. Not having a partner who can do this with you. Feeling shame at the gym. And then, of course, we also have the personal factors related to beliefs, just about their perception of the disability or their inability to do things. Having a fear of injury or pain or another stroke as they exercise, for example. Having a lack of interest in sport, which I already mentioned. I think sometimes that's the assumption. Not having the time, or maybe not being able to, maybe you're relying on someone to get you there, but they don't have the time. An aversion to new experience. We also did a similar needs assessment that it was kind of interesting because we started out just doing that. What kind of benefits do you see from adaptive recreation type survey? And then we realized very quickly that, oh wow, I don't think people really understand what adaptive recreation is. Maybe we need to step back and actually look at, do they know what it is? Do they know how to participate in it or where to find more information? And we actually had a whole new study kind of come out of that. But as it turned out, our surveys actually said that about half of the people that we surveyed did not know what adaptive recreation is. But 100% of those who didn't know wanted to learn more about it. Everyone wanted to know more about it. And 56% of participants who knew about adaptive recreation have participated. Some of the barriers for those who did not, or who knew about it but were not participating, said that there are no programs locally and that it's too expensive. So we were seeing some very similar barriers to some of the things that were noted in these other studies. Okay, so how do we actually help patients find ways to connect with activities and hobbies after they've had a stroke? So I think some of the takeaways here are certainly that the information we just saw about potential barriers and facilitators, use this information to guide discussions with patients surrounding participation in things that they previously enjoyed, and new recreational opportunities after a stroke has happened. Tell patients and their family about adaptive recreation. Don't assume they know what it is. Don't assume they've heard it before. And I want to say, just like when we're talking about checking in with patients about their mental health, you want to do it along the continuum of care. We don't just want to present it all up front when they might just not be ready for it, but maybe also present it later on. Don't assume they've heard about it before. Don't assume that they've retained it if they have heard about it before. And again, I think also including family members in that discussion, and I use family in a fairly broad sense here. But they might also be interested or maybe encourage the stroke survivor to look into this. Make it meaningful to the patient. Figure out what would you enjoy to do, or what do you think you would like? And maybe set the expectation that if they try something new, or even if they try something they've done before, it's okay if they don't like it as much, or if they decide like this is not for me. There's lots of things they can try, right? The important thing is to start trying some things. Also, timing may be everything. Re-engaging in social and leisure activities after stroke is a long-term process. And there might be just various types of support that may be needed during different stages of recovery and adaptation. Problem-solve barriers to access with your patients. And also think beyond structured programs. So, some of the things we're talking about here, or that I'm talking about up here, are as part of these structured programs. So with Wasatch Adaptive Sports, I'm going to be talking about trails here in just a minute, which are programs we have. But there's also a lot of ways that recreational activities can be adapted that's not necessarily tied to these groups or these programs. Get creative. As I just mentioned, I'm going to talk just a little bit about the Trails program. The Trails program is at the University of Utah, our Craig H. Nielsen Rehab Hospital, and we're really fortunate to have this program. It's been in place for a while now. Initially, it just focused more on spinal cord injury, but in the meantime now it's also included stroke and TBI. It is a year-round, it's free. But the year-round activities that participants can incorporate into a daily active lifestyle. And I wanted to share this video. I don't know if you'll watch the whole thing, but and now we don't have sound.
Some who might not have even thought to go because they can now, thanks to an invention put together by the University of Utah.
Yeah, it's for those with high-level complex disabilities, and it allows them to ski downhill. All you need is some courage, and as new specialist Alex Cabrero explains, a breath of air.
These are the days Dustin Godnick can't wait for.
Like turned in a little bit.
Where he remembers what skiing feels like.
It's nice to come feel the sun.
Godnick was worried he'd never be able to ski again.
Stay on it, stay on it, stay on it.
After that car crash when he was 17 years old.
Broke my neck, basically the fourth and fifth vertebrae.
That was in 2001, and for a kid who grew up skiing in Park City, it was devastating.
Technical term is tetraplegic. Another term for it is quadriplegic, but I can move my arms, so really it's tetraplegic.
Since then, though, technology has caught up.
There's no other ski like it.
He's talking about this sled called a tetra sled or tetra ski, which was designed by University of Utah scientists and engineers.
We have electric actuators on each ski, and those are controlled by either a joystick, if you have enough upper extremity function, or if you don't. If you have no function in your trunk, your arms, and even your neck, we're able to use your breath to actually control the ski.
That's right, your breath, using a little tube in your mouth.
You can actually puff a little bit to turn right, sip a little to turn left, and you have control of everything in between.
And here they come.
It works so well, the adaptive ski community would like to have it included in a future Paralympics.
Step by step, we are getting closer.
There has never been a winter Paralympic sport quadriplegics and other complex disability athletes could compete in, but this sled could give them that opportunity, maybe in 2026 Italy, or even 2030 Salt Lake City, if Utah gets the bid.
Using just what they have above the neck left and making it happen independently. That is, I think that's my dream.
One of Godnick's dreams came true.
Get me out on this, and I love cranking it up.
Oh yeah!
Getting up here feels fantastic.
Now all he wants to do is go faster. Alex Cabrero, KSL 5 News.
So I will have to pass that on. So the reason why I wanted to show this, I think, yes, this was a spinal cord injury. The participant or the athlete that we saw here did have a complex spinal cord injury, but we do have individuals who have complications due to stroke participate in these events. And Dr. Rosenbluth made me promise that I emphasize that, you see the person, the instructor who's kind of holding on has the leash, thank you. I'm struggling this afternoon. It's a good thing the audience is with me, active participation. But they're not doing anything to control the chair. The control is entirely within the person, the athlete who is in the chair. And we have different ways of controlling it. And actually, this is a couple of years old. In the meantime, we're now working on not me personally, but our engineers are working on a brain tech interface where we're using that, or even like if someone has very little like muscle use in here, using just very, very, even the weakest of sort of signals that is sent to the muscle can be picked up by the chair to steer it. And so my point with this is that, I think there's often this idea that like, oh, like this disability is too severe, right? We can't do anything here. But that's not the reality. And I realize this is maybe a bit of a special case, but it is available. And so this, I don't know, I hope this is as exciting to you as it was to me when I first learned of it a few years ago.
So it does stop too, if you control the stopping?
Yes. The leash that's on there is in part a safety feature, right? But more often than not, they're just trying to keep up with the chair because these athletes are ripping down the slopes. It's incredible. We've again, this is sort of my pet project. I really love being involved in some of these adaptive recreation events. So I volunteer at the ski tournaments that they have and some of the cycling activities. I do all of that stuff, and it's a lot of fun. But we get to really see, they are performing at really high levels, and it is so cool. It is so cool. Geeking out here for a minute. Did I mention? Okay, I'm going to circle back to trails here in just a minute. But I did, of course, I'm sure y'all are interested also in some of the adaptive recreation or adaptive sports opportunities here in Montana. Now, I had to search these out, so I apologize if I didn't get all of them on here, but these are some of the ones I came across. I put the websites on there. And so hopefully, if you haven't learned about these yet or don't know about them, you can check them out and see what they have available as far as programming goes. But similarly, it kind of spans, or there's a lot of different opportunities in terms of recreation. I think just like in Utah and Montana, people are very passionate about their recreation. Kind of addressing this access and distance as a barrier. I think this is where the yeah, but often comes along. It's like, okay, this is great, but I can't get to it, or I just don't have this locally to me. But this is one of the greatest challenges, is this barrier of distance between the rural areas especially and hospitals where often some of these programs are housed. And so there is some virtual outreach that happens kind of using web-based and telemedicine or telehealth links that can expand reach. And so I put a couple of different links up here so this is the National Ability Center, which has its home base in Park City, Utah, and then we have Trails up here as well. But they do actually offer sort of these virtual or virtual outreach or opportunities for adaptive recreation. So I encourage you to check into those if that seems like something that might appeal to you. Because, as I had mentioned, one of the things that really surprised me was when we did this needs assessment survey and we realized, oh my goodness, like people don't even know what this is. And they don't know where to find information. Maybe what we should do as part of this is actually then reach out to the people and provide them with, some information of how they might find opportunities in their areas. And so we kind of tack this onto our survey. If they click like, yes, I'd like to find out more about opportunities, they would get this PDF sent to them. But I decided to go ahead and include it here too because this applies here. Start with an online search. You can try to Google it, using something like the adaptive recreation programs in wherever your area is. Or search for different ways to adapt activities, like adaptive crafting ideas or ways to cook after stroke. One-handed anything will bring up information on how to adapt activities, right? One-handed cooking, one-handed knitting, whatever it is. Check with your local parks and rec department. Many cities offer adaptive recreation programming at a low cost or may know other local resources to point you towards. And then we also have this website on here where you can search for programs by state. Funding or having the money to pursue adaptive recreation or to get the equipment, which is often very expensive, can also be a barrier. And so here I just have a couple of resources for funding and available grants if this is something that your organization might be part of or interested in doing. So depending on the patients that are seen at the facility, there are also opportunities for grants through foundations and agencies. So I listed the Christopher and Dana Reeves Foundation on here. Obviously, they're more interested in funding spinal cord injury related projects. But this is one way that we were actually able to get access to, I think maybe a dozen or 15 spin bikes that we can use with anyone. Yes, it's intended to use with our individuals with spinal cord injury, but we can obviously also use it for others who might need it. And we actually have a really cool project planned for those that's geared towards rural communities, where we are planning on bringing these adaptive cycles out into the communities to have people participate remotely in adaptive cycling programs. A little plug. And then here it's just another list of resources. I decided that maybe this is what was needed, was to just get a bunch of different websites, information, even things like adaptive fitness centers and gyms. Like if someone is interested in, I'm going on a trip to wherever to see my in-laws, but I'm interested in making sure that there's a gym in there that has the adaptive equipment that it needs, or that I would need, this is where you might find it. There's these sites on stroke rehab with home exercise equipment and adaptive fitness centers and gyms. There's a ton of information in there, so I would encourage you to go check that out. And then also there's a podcast that I've included here, and it's really more of a personal account from Shana Harrington. It's a really good listen. And it might be something that you could share with maybe patients and their families if they're a little bit unsure as to what might be a benefit to them or what this might be. Okay, just one more time. And I'm not going to go into all the details here, but just as a reminder, we are still recruiting for our study for couples to promote resilience in couples coping with stroke. Here's our inclusion criteria again. And if you'd like more information, I have flyers. We have lots of different things. I'd be more than happy to talk with you about all of that, but I'm going to open it up to questions at this point. Thank you all so much.
Thank you. I thought that was a great presentation. So you talked about adaptive recreation, and we have tons of information out there about the benefits of recreation in general to people that don't necessarily have injuries. But to me, it seems like there's kind of this window in between of maybe people that have strokes that are highly functional and don't require adaptive equipment. Have you guys thought about trying to do studies for whether it's stroke specific or brain injury specific with recreation and the benefits behind that?
That's a really great question, and actually there are some studies already out there. In particular, some of the things that people are looking at are, because we know some of the benefits that, say, like physical activity, for example, has on depression, right? We know that, I mean, there's some research now that shows that it might be just as beneficial, if not more beneficial, for treating depression than an antidepressant. So, you know, I think in that respect, there are some studies that are coming out. I think it's a little bit less researched, just because there's maybe this assumption that, like, oh, they function as usual, right? So I think it would be an interesting area to look into for sure. But there is some research out there, specifically more on the physical activity piece and the benefits in more milder stroke, for example. Did that answer your question?
Hi, I'm an occupational therapist also, as you figured by now. But the picture you had with the paintbrush, and they had like the adaptive device on the hand, do you find that helps with like a really spastic hand, or do you have any like interventions or recommendations for people with really bad, severe spasticity?
This is where I wish I was an occupational therapist, because I do not know the answer to that. Does anybody else know the answer to that? For severe spasticity or spastic hands using a ball? I think somebody in the back.
So I'm not sure exactly about that, but there's something called the Ready Steady glove. Has anyone heard of that? We're trying to get one right now for one of our residents with pretty severe spasticity. So I don't know a ton about it, but that might be an option.
Any other questions?
Someone did put a comment in the chat from Zoom saying that Montana Group of the Blind had tons of help with people needing seeing adaptive equipment. So there could be an option there. So Montana Group of the Blind.
Great, thank you.
I have kind of a question / comment, more of a comment maybe. I was really glad you brought up the rural aspect and being far away from adaptive programs, because I think that that's really what we deal with in Montana. And last year I remember talking about Eastern Montana and how far they were away from any sort of speech therapy, occupational therapy, or physical therapy. So I think looking into resources to do the sort of DIY adaptive therapies would be really good. But I'm sort of curious too about people who suffer from strokes or disabilities in rural areas who don't have access to this. Are their depression rates higher? Is there any research or information about that?
No, that's the short answer. I think at the beginning of the talk, I kind of mentioned that there really wasn't a ton of research on stroke and adaptive recreation, or, you know, what are some of the, I mean, there's just not a lot that's out there, unfortunately. So, and I don't know how that actually specifically plays out in rural areas. I would assume that we can kind of use some deductive reasoning, and, you know, yes, we know that not participating can increase depression. Participating could potentially, you know, ameliorate depression, and so maybe if you don't have the access, then that could compound the issue. That would be my best guess, but yeah, it's funny because you know, one of the things that happened as a result of COVID was that, like, all of a sudden. So I mentioned we're really lucky. We actually have a lot of adaptive rec resources in our area. I think there's like 4 or 5 different agencies that are within driving distance of Salt Lake City that do adaptive recreation. And then during COVID, access to all of those was just non-existent. And so we actually worked with a lot of these teams, the rec therapists and so on, who were like, okay, let's try to figure out how to get people access to these programs now that they've suddenly been cut off. And so, yes, there's a need to be creative. You know, yes, we're kind of past the I don't want to say we're past COVID, but, you know, like we're kind of reintegrating, we're getting back to doing the things that we did in terms of social activities, but the reality is there's still a lot of people out there who just can't access it because of other reasons. And so being creative, coming up with different ways to do it, you know, I would still think if there is a need for connecting socially, that perhaps just the adaptive equipment alone isn't going to be enough. But, you know, join a Facebook knitting group or something maybe. I don't know. That's, again, it's where you can kind of get creative and problem solve with patients and their families.
I think that to answer her question, because I'm from very rural Montana, and the only way for us to get stroke victims out is by flight. We don't have access even to rotary, so you're going to go out on an airplane or you're not going out at all. And the nearest place for us to send stroke victims would be Billings. I think one of the biggest things that we battle is cost and economic, because families, you know, the first thing they say to us is, oh my gosh, you know, we have to fly. How are we ever going to afford that flight out? And then, you know, you start talking to them right away about rehabilitation and things like that. You're talking about rural farmers and ranchers that don't want to be away from home. They want to come back home and rehabilitate, but we don't have that option or even any access to that there. So that makes it even that much harder to accommodate them. And then, like I said, the economic value, the depression level in rural Montana, like in our area, is supremely high. And then you add on top of there that the winters now are 6-7 months long. And so, yes, our suicide rates are extremely high. Our depression rates are extremely high.
Yeah. Yeah, thank you for speaking to that.
Just a resource for rural farmers. There's this OT in Billings, I think her name's Kendra. She has a podcast called Cutting Fences, and she has gotten grants and has adaptive farming equipment for people available to use for free. So that's a resource for rural populations.
Any other questions? A comment?
This is more related to your earlier session. I just wanted to say I really appreciated that, because when I was doing my master's program, it just seems like the topic of intimacy is like so taboo for so many people. And when I was working at Kaiser as a therapist, they did like a special hip class for people that were going to have surgery. And it was like this really long, like thick book that we had to review. And that chapter, like everyone just wanted to skip over. People were and I mean, these are like seasoned healthcare professionals. And one of the really most memorable things I learned in my graduate program was one of our professors said that there's this myth that, when we get older, we just stop, we're not intimate anymore. And she said it's actually one of the last biological functions to deteriorate. So I just want to say I really appreciated that talk.
Yes, thank you. It is such an important topic. People don't want to talk about it, but everyone wants to talk about it, right? I think I got a question over Zoom for the earlier talk that I don't think it was read out loud because it came in later, but it was about the ages of our couples, and could this be adapted? This program be adapted for couples who maybe aren't in that more traditional stroke patient range? And what I neglected to mention, I mentioned it last year, but I didn't mention it this year, is that actually about half, if not more than half, of the couples who are participating are younger. They're in their 40s and younger, which suggests that, one, we are seeing more stroke in younger adults, but also there's a need here, right? I think maybe they are just looking for more resources, and certainly, sex and intimacy is important across the lifespan. Across the lifespan, I just wanted to reemphasize that it is one of the most human things, and so for us as healthcare providers to not address it with patients and their partners is a missed opportunity.
Any other questions?
Yeah, Alex, could you go back up to the Montana resources that you Googled?
Yes.
Because I know at one of our Mission Lifeline subcommittee meetings, and then at the Montana Stroke Initiative meeting last year, there was a group, and they had put in, I think, 5 like adaptive river accesses across the state, and they had a lot of other equipment available, and I don't think it's any of them that are, maybe it's the Montech Recreation, actually. Yes, yeah. So I think there are some opportunities, and I think if you go to the Montech website, they have a lot of resources, and I think they want to hear what people in Montana are looking for, so they might be interested in hearing about, the farming adaptive equipment as well.